Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you for making us a part of your day once again. Going to have a conversation with Mr. John Incledon. He's president of Hisamitsu America, the U.S. division of Hisamitsu Pharmaceutical Company, Incorporated, to talk about the CDC's recent recommendation for physicians to consider the use of safer topical analgesics as the first-line treatment for chronic pain. Welcome to Health Professional Radio, John.
Thank you very much, Neil. Very pleased to be here.
Well, I did mention, of course, that you're the president of Hisamitsu America. Give us a bit of your background. Have you always been into pharmaceuticals? And talk about your role there at the company.
Yes, Neil. I've been in the drug industry for about 32 years. I started with a company called American Cyanamid, and there's been a lot of consolidation in the drug industry. Ultimately, about 25 years later, they became Pfizer as a byproduct of acquisition. I left there in 2010 and joined a Japanese pharmaceutical firm, Hisamitsu Pharmaceutical Company Incorporated, and I've been here now just about 9 years.
They're the makers of a very successful, a legacy in topical pain relief, I do believe.
Yes, they are. Actually, the company is nearly 180 years old, and they were really founded on the principle of topical pain relief. And the business and actually, if you will, our motto is to help people around the world manage their pain through the patch. And that includes prescription medicines, that includes over-the-counter medicines. Our leading brand happens to be an over-the-counter topical called Salonpas, and that's marketed in about 40 countries around the world.
That topical aspect of pain relief is not the norm when it comes to managing pain. Just look at the opioid epidemic.
Yeah, Neil, you're touching upon something that is very relevant today here in the United States, and I would add Canada into that mix as well. North America really stands out relative to the rest of the world in terms of pain management and the approach that's taken here. Being an international company, being that we market products in some 40, 50 countries around the world, we get a pretty good overview as to what the practices are for pain management in many of these countries. And here in the United States, there's a very strong skew towards treating pain with oral medications. Mm-hmm. And in general, there's nothing wrong with that. But there are concerns that can occur when they're overprescribed or overused. And bear in mind, here in the United States, we have some NSAIDs, non-steroidal anti-inflammatory drugs, available OTC orally that are also available by prescription, the difference being the milligram load. And so it's possible that consumers self-treat here, even at the prescription levels, using OTCs. And when they do that, they take on some additional risks that you wouldn't find in using topical analgesics. By the way, with opioids, for instance, part of the reason that I think we've had a crisis here is it's not been well understood that as few as 6 days of use of opioids can lead to addiction. And in fact, I see now on television public service announcements highlighting that after 5 days of use, you have a risk of addiction. So these are things that are coming into play that raise the question of what is the best practice or a safer practice for helping people manage their pain.
When it comes to drugs like fentanyl, highly addictive, highly potent, I was under the impression that was delivered topically through a patch as well, but apparently people are modifying it, changing it, doing certain things with it to make it even more dangerous and possibly even more addictive. With these over-the-counter medications that don't have the same type of side effects, is it possible to manipulate them in a way that nullifies their effect or enhances the effect in some negative way?
Well, Neil, first of all, with respect to patch technology, there are patches that are designed to have medicine actually push through and into the bloodstream. Mm-hmm. So when you talk about fentanyl, that happens to be one of those products. So even though it's applied topically for a consistent level of dose administration versus taking it orally, that is intended to get into the bloodstream. The topicals that we manufacture for pain here that use an NSAID called methylsalicylate, that use menthol, that use lidocaine, very little of that medicine enters the bloodstream. They work locally, right at the site of the pain. So there's a big distinction there. You can use patch technology to push medicine into the bloodstream. But in our case, we're talking about locally applied pain relief. And that's a real advantage, right? Because a lot of folks don't know, and I'll kind of bring this down to its lowest common denominator. When drug companies create a pill and they're trying to find what is the dose that's needed in order to provide the level of efficacy that's also safe, what you find is the body's protective systems, the filters, the liver, the kidney, okay, they tend to knock out a lot of the drug that is put into the system, which means that the pills that are made have a lot more drug than what's needed to actually relieve the pain, because they have to have enough left over to get to the body's to get to the site of pain and actually relieve it. So, these are toxins, right? And the body is trying to filter those out. So when you apply something topically that doesn't enter the bloodstream, you're not affecting the kidneys, you're not affecting the liver, and you're also not affecting the stomach. I think people understand that opioid addiction has led to hundreds of thousands of deaths since 2000.
Yes.
But let's not also diminish what prescription NSAIDs. So I'm talking about naproxen sodium. I'm talking about ibuprofen and even acetaminophen, which folks often think is very benign. If folks overuse those products, they're taking on significant risk. Gastrointestinal bleeds from NSAIDs kills a lot of people in this country every single year. And acetaminophen has what we call a narrow therapeutic window, which means that the level of efficacy is only slightly lower than the level of toxicity. And the problem with too much acetaminophen is basically it leads to liver failure. So these are things that are avoided when you treat topically.
Now, as far as treating topically, is it something that we can basically replace the traditional way that we treat pain here in the United States and Canada? Is it something that can be replaced?
Well, I think there's been a fair amount of skepticism about topicals within the medical community. There's really been no first causer that's been in the medical schools, that's been detailing physicians and educating physicians on topical medications. But at the same time, there's more clinical evidence now about their benefit than there ever has been. In our particular case, we have what you would call a gold standard study, which means it was a double-blind, placebo-controlled, multi-center study that we used as a pivotal study to gain approval of a new drug application. So any drug company that is marketed in the United States with a prescription uses the NDA process, the new drug application process with the FDA. The reason an OTC drug would do that is that they want a unique or distinct label. When we filed our NDA, we were able to demonstrate that our product was effective not just in mild pain, but also moderate pain. And I'm talking here about muscle and joint pain. And we have the distinction of being indicated to treat both mild and moderate pain. So if you think about pain, think of it on three levels: mild, moderate, and severe. Okay, we're the only OTC, including oral NSAIDs, ibuprofen and naproxen, and for that matter, acetaminophen, that is indicated to treat moderate pain. Everything else is only indicated to treat minor pain. So that's one piece of clinical evidence. Again, placebo-controlled study. All right. There's also two additional studies that have been done fairly recently. Think about lidocaine. Now, lidocaine at the 5% level was a prescription drug that was indicated to treat post-herpetic neuralgia, or shingles. Mm-hmm. It had a very limited indication, but there was a fair amount of off-label use for muscle pain, for back pain, for joint pain. And there was a study done, what we call a non-inferiority study. So this kind of study looks to demonstrate that when you apply the 5% product to the same set of pains as you apply the 4% product, is there a difference in outcome with respect to efficacy? And in fact, this study showed that a 3.6% lidocaine, 1% menthol combination, there was no difference in efficacy with the 5% prescription lidocaine, which, by the way, for the manufacturer of that product, of that branded product, was a $1 billion drug.
Where can our listeners go and learn more about the importance of topical analgesics, why physicians are being recommended to consider it as a first-line treatment in chronic pain, and more about your company as well, Hisamitsu America?
Well, Neil, I would suggest to any of your listeners that they check out the Center for Disease Control website. They issued guidance to physicians in 2016 on how to manage pain without opioids. In part of the training materials that were associated with that guidance, there was a clear statement that topical analgesics can be considered a first-line treatment for pain, and there was a recognition of the safety consideration associated with that, with those line of products. So I think from a governmental endorsement standpoint, I think they're suggesting, consider topicals as a first-line treatment. From our company's standpoint, Salonpas is available in food, drug, and mass outlets across the United States. And I think anybody that's in your listening audience that is considering managing their pain, that they give topicals a try. I think you're going to find that the efficacy is there, and I think you're going to find that the greatest concern you're going to have is some redness or some pain associated with what you might get with a bad sunburn, and that's on a limited basis.
Thank you for joining us here on Health Professional Radio. Hoping to talk with you again soon.
Thank you very much, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.